question. Right, so if you read and understood, kindly
Yes, ma'am.
tell me the identification of, if you start from on the left hand side, picture A, number 3.
Yeah, ma'am.
Number 3,
It
please.
is the head.
Sorry.
Ma'am.
Okay. And then
And
number 2.
yeah, 3 is head.
Yes.
Yes, ma'am.
2, please.
6 is the neck of the femur.
Yes.
And 2 is the greater tuberosity.
Yes. And then
And
moving
4
on
is
to 4. Yes.
The intertrochanteric crest, ma'am.
Okay. What about
Yeah.
5?
And 5 is the, I think, ma'am. Oh, okay. It's the laser tuberosity.
Okay. What inserts at
Yes, ma'am.
number 4? There is, yes. What inserts there?
Ma'am, actually the quadratus.
All right. Can you tell me how hip joint is formed?
Yes, ma'am. Hip joint is formed between the acetabulum of the pelvis bone and the head of the femur, ma'am.
Okay. What is this 9?
9, I think, ma'am, it's gluteal tuberosity.
Okay. Can you identify 11 here in picture B of the left hand side?
Yes, ma'am. It's trochanteric notch.
Okay. And number 5?
The tuberosity.
Yes. What inserts here?
Ma'am, actually the psoas major and iliacus muscle inserts here.
Okay. And number 3 here?
Number
Yes.
Yes, ma'am.
Okay.
Head of the femur, ma'am.
Yes. And in 1, if you can look closely, there is this punctum or opening. This is from here, which vessel goes in to supply the head of the femur in adult? Yes. Am I disconnecting or what? I can hardly hear you.
The artery of ligamentum teres, ma'am. It's a artery of ligamentum femur that arises from up.
Okay. Can you identify on this on the right hand side, picture A, number 3? Yes. Three, 12, 5.
Hello.
Yes, I can hardly hear you. Actually, I cannot hear
Is
you.
the trochanter 12 is the intertrochanteric.
Yes. And then 5?
5 is the, ma'am, intertrochanteric line and yeah, and 8 is the, ma'am, laser trochanter.
Okay. And then 11. Yes. 11, and then I want you to tell me number 4.
Hello, ma'am.
2 and 9.
Two, ma'am, 9 is the shaft of the femur,
Yes.
ma'am,
And
and
2.
2 is the ma'am, it's the upper end of the linea aspera, ma'am.
Gluteal tuberosity, it says. Okay, and
Sorry,
in
it's
the picture
gluteal tuberosity.
B,
Yes,
this 4. 4, please. 4 and then 11.
No, you are not audible.
Sorry, 4 and 11, 6 and
Hello.
3. Yes. Yes, please. Can you hear me now?
Hello.
Yeah, Dr. Ulfat, you are audible, ma'am. It's
Sorry,
not audible.
I
No,
got
ma'am, it's okay.
disconnected. All right. Okay,
Yes,
4,
ma'am.
11, 6 and 3, please.
Ma'am, 4 is the head of the femur, 11 is the neck of the femur, 3 is the greater trochanter of the femur, and
Okay.
6 is, yeah,
Intertrochanteric line. All right.
intertrochanteric
And
line,
then in the C, if you can identify these
yeah,
circle.
ma'am. The 4 is the head of the femur, 11 is
Yes.
the neck, and 8 is the lesser trochanter.
Okay, good. All right. Moving on to the next one because time is running out.
Yeah, sure,
What do you
sure,
see
ma'am.
from the superficial to deep, all the muscles, if you can identify. This one
Yes,
is
ma'am.
sacrum, and then what are these on both sides?
Yes, ma'am.
Starting
At
from
first,
here, if you can start from the left and all these.
yes,
What
ma'am.
is this?
This is the iliac crest, ma'am. It is the highest
Okay.
point, the tubercle of the iliac crest.
Then which muscle could this be?
That is gluteus medius. Then over that is gluteus maximus.
Okay.
Yeah.
And if you can
And
please
in
keep
the on the
telling
right
me.
hand side, that is, yeah, right hand side, that is, ma'am, that is,
You told me all these. Okay.
yeah, ma'am.
This is
Yeah.
tuberosity. Okay. Then which
Sacrum
one
and
is this?
coccyx, yeah. That is gluteus minimus, ma'am. Then
Okay.
piriformis,
All right. Yes.
piriformis superior gemelli,
Yes.
obturator internus, inferior gemelli, and quadratus femoris.
Very good. Okay. Next. If you can help me to read what image is this?
Yeah, I think it's now left-sided femoral artery angiogram.
Okay.
And one is, ma'am, the catheter in the external iliac artery. 2 is the
Okay.
femoral artery, and 3 is the lateral circumflex femoral artery. 4 is the medium circumflex femoral artery.
Yes.
6 is the profunda femoris artery.
Very
7
good.
is superficial femoral artery, and 5 is the perforator arteries, ma'am, arising
Very
from
good.
profunda femoris artery.
All right. If you can tell me this one, starting from here.
It's
On the left
ma'am,
side.
angiogram of the lower leg, ma'am, actually below
Very
the
good.
popliteal fossa.
Yes.
And the upper one, that is popliteal artery, and the first
Yes.
branch that is arising, that is anterior tibial artery.
Yes.
And
Please.
then the before the 2 branch, that is tibioperoneal trunk, and the
Yes.
middle branch is peroneal artery, and another branch is posterior tibial artery.
Yes, this one is posterior tibial. Very good. Okay, can you tell me how many compartments there are in the leg?
Yes, ma'am. There in the lower leg, there are actually, ma'am, 4 compartments. That is
Very
one
good.
anterior compartment, one lateral compartment, and in the posterior compartment there is superficial and deep compartment.
Okay, what are the nerves of each compartment, please?
For the anterior compartment, there supplies the deep peroneal nerve motor supply, and for the lateral compartment, superficial peroneal nerve, and for the posterior compartment, for both superficial deep, that would be tibial nerve, ma'am.
Okay, can you demonstrate in words, description, how would you test the knee and the ankle reflexes?
Yes, ma'am. For taking the knee reflex, the knee should be flexed, relaxed off the ground, and then I will just I'll tap on the patellar tendon, and I'll expose the quadriceps muscle, and after tapping I'll just look at the contraction of the quadriceps muscle. And for the ankle reflex, I'll flex the leg, and ankle will be also be flexed and dorsiflexed actually. Then I will tap on the and I'll look at the calf muscle, and I'll tap with the tendon hammer on the Achilles tendon. I'll look for the reflex contraction of the calf muscle, ma'am.
Okay. Can you tell me what inserts on the tibial tuberosity?
Ma'am, on the tibial tuberosity, there inserts the tendon of the patellar tendon actually inserts in the tibial tuberosity.
Very good. Yes, it was easy, right?
Yeah.
Okay. Mostly time got wasted with the.
Yeah, ma'am. The picture I couldn't hear you. Sorry, ma'am.
I never got any feedback. You listen to the recording. I never got any feedback. I was like asking and. Okay, can you tell me what are the structures which pass through the medial malleolus from anterior to posterior?
Behind the medial malleolus, from anterior to posterior, there at first there will be tibialis anterior tendon yes. of the flexor digitorum longus, and there will be tibial posterior tibial artery and tibial vein, and there will be tibial nerve, and there will be tendon flexor of flexor hallucis longus.
Okay, good. Can you tell me what are the motor and sensory functions which are lost if there is injury to superficial peroneal nerve?
If there is an injury to the superficial peroneal nerve, there will be lack of sensation in the yes. Anterolateral aspect of the lower leg, yes. And the dorsum of the foot, except the first wave space and along the medial over the medial malleolus and over the lateral foot margin, except that area. And there will be loss of eversion and some to a lesser extent dorsiflexion of the foot, ma'am. Okay.
In case of there is injury in the leg, how would you recognize if there is compartment syndrome?
Okay, at first I'll look for the first sign that there will be pain out of proportion on passive stretching of the leg, and which will not be controlled by the analgesics. And then I'll look for the neurological signs. If there is any paresthesia, especially there is any absence of 2-point discrimination sign, and if there is any swollen leg, tense, tender, and swollen leg. And also at the later sign, I would like to look for if there is any evidence of absence pulse or not, ma'am.
Okay, one last question. Kindly.
And I will also measure intercompartmental pressure, ma'am.
Very good. Okay, can you tell me the lymphatic drainage of the leg?
Yes, ma'am. Lymphatic drainage actually drained by two groups of lymph nodes, that is the inguinal lymph nodes and popliteal lymph nodes. Okay. And popliteal lymph nodes actually drain, ma'am, over the lateral aspect of the leg and foot. To be more specific, it drains from the small skin proportion above the heel and also the deep calf muscles area. And from the popliteal lymph node, that will be drained by the inguinal lymph node. And from the inguinal lymph node, actually that drains the most of the other areas of the foot along the distribution of the great saphenous vein, and the popliteal lymph node drains from along the distribution of short saphenous vein.
Very good. Okay, good.
Yeah, ma'am. Thank you.
Most of the questions were already covered when we did the inguinal region and all that. It was the popliteal region which was left. So I thought, okay, we'll go from above downwards and we'll cover the whole. It will be like summary of whole lower limb, starting from the hip joint and then ending all below. Okay, many questions could have been asked here, but this is how much I could recall to ask. But if anyone want to add any important questions, they can add. Yes, please.
Hello.
Yes, please. Hello, good evening.
Hello, good evening, ma'am. Dr. Abhishek, I only wanted to add one thing that in femur it's greater trochanter, while in humerus it is greater tuberosity. Yeah,
I've seen that everyone just
That's the
say,
only
everyone
thing.
say,
Yeah,
saying, yeah.
Yeah,
Otherwise, you were very
otherwise it was good.
good.
Yeah.
Great. Yeah, answered all the questions.
Thank you. Thank you.
And what are the important
except
questions in relation to linea aspera that, I mean, other than the surface marking, is there anything?
yes, what attaches there and what's the importance of that attachment? This is what I can recall on tip after asking all these members for some months. But then you can read more in recalls if it has been asked.